Welcome. Today we are meeting with Dr. Beverly Chang. I am Carol Kinsel with Senior Care Solutions, and this is the second online series that we have done so far. I'm so glad you're joining us. I'll start by introducing myself. I'm Carol Kinsel, owner of Senior Care Solutions. We're a resource center in Fair Oaks, serving 5 counties in the greater Sacramento area. We've been in business for 23 years, and a very large part of what we do is education. Thus, the reason for these events that you can tap into, especially during the time of sheltering in place. Dr. Beverly Chang is a dear colleague of ours, and we've worked with her on multiple projects and share some mutual clients. And it's our pleasure today to have her here. She is a graduate doing her residency at UCSF Fresno, University of California, Fresno, and her specialty at UC San Diego. She still has an affiliation at UCSF Fresno, and is affiliated with their Memory and Alzheimer's Disease Clinic. So she is in private practice, geriatric psychiatry direct in Rockland, and she sees patients with neurological disorders, depression, anxiety, and just really promotes healthy aging in her practice. In her private time, she enjoys playing with her 2 cats, spending time with her husband, and she's a big exercise buff and had to relocate her gym to her garage, as many of us all did, right? With this, everything shutting down. So welcome, Dr. Chang.
Thank you.
It's so nice to have you here.
It's a pleasure to be here.
Thank you.
From home.
From home, yeah. So let's talk about the changes you've seen in your practice. How are you reaching out to your patients at this time?
Yeah, looking back, it's so much has happened so quickly. And so I'll give you the evolution of how things started to change. Being that I'm kind of a huggy person, I would always give my patients a hug at the end of the appointment. And first it started with, okay, got to keep social distancing in mind. And so that pulled back. And then we shifted a little bit more to having, encouraging people, if they could, to stay home. But being that my office is pretty low flow and there's just me, there's nobody in the waiting room. We were sanitizing everything after patients would come. We did that for a while. And now with the most recent guidelines about sheltering in place and of course wearing masks in public too, just for the safety of patients and the office staff as well, we have transitioned everybody to telehealth visits. And that was as of like 2 weeks ago, even though it seems like it's been 2 months already.
Doesn't it?
And there was a lot of hesitancy on older adults to implement the telehealth just because maybe lack of familiarity with technology or just not liking it that way. But I think for the most part, people have done very well. And sometimes it comes with the coaching of my office staff to help people set up Zoom accounts or other platforms. What seems to work the best for me right now has been FaceTime, because if people have iPhones or iPads, I just have to call in and it's as simple as picking up a phone call. Yeah. So we've made that transition pretty well. For the most part, the patients have been on board with it. And I, of course, really miss that personal connection. You just miss all the subtleties, the nuances and body language. And of course, it's hard for me to look at a computer screen or a telephone screen all day. But those are the major changes that we've implemented in the office. We're still there to fill prescriptions, to answer phones, and to be there as a support for people who call in. And to be there, of course, for each other, because it lends itself some normalcy when I can see my office staff in person as well.
And we're feeling the same thing at our office at Senior Care Solutions, because we're all remoting in. We're helping our clients right now, but we feel a loss because we can't have that personal touch that we're used to as well. Are you seeing an increase in anxiety and depression with this increased isolation for folks?
This is an interesting point, because we're always talking about the concern for an increase in depression or anxiety. And actually, I would say about half of the people that I have been seeing are coping fairly well. They say, well, not that much has changed actually, because maybe they were struggling with anxiety in the past, and didn't really like going out and about, for driving issues, for self-esteem issues, and now they're saying, well, I'm actually doing okay. People are feeling more isolated from their families, I would say, and there's that, especially this being Easter, there's the family gatherings that are missed, or the birthdays of the grandchildren that are missed. So definitely people are noting that, but I think overall doing pretty well about trying to cope with it.
And I was talking to a residential care facility administrator today, and she mentioned something pretty interesting to me, because I hadn't even thought about that. She said her residents are isolating in their room, and they're trying to get them out a little bit, and but they have to follow protocol. And she says there's been an increase in falls. And, amongst the emotional turmoil that goes on, or the isolation, depression that we're dealing with, she said they're not getting out as much exercising, so they're losing their strength. So they're trying to come up with better programming where they take one out at a time to walk and that sort of thing.
I've worked with a few board and cares or senior care communities, and that's sort of that's another population. So thank you for bringing that up. They're of course on lockdown. I know of at least one family that has chosen to take their loved one out of the facility for this time, which is up to them. There's pros and cons of both approaches.
Right.
I've actually worked with some of the smaller boarding cares where if a staff member is able to let me temporarily use their iPhone or other smartphone, then I'm able to just give a little bit of boost to my patient who is not able to get into the office currently. Families have been doing that as well. Like I knew one family that it had to be behind a closed window, but they would call their loved one and just do kind of like a through the window greeting. So there's creative ways of just letting people know that we're thinking of them. With regards to the social distancing within senior communities, I've heard, you might have a little bit more up-to-date information as well, but I've heard from several that actually residents are allowed out of their rooms. They're allowed to go to the dining rooms with no more than 2 or 3 residents per table. They're still doing activities, which is great. They're just not up to what was, of course, but of course,
right.
we are all human,
right.
normal.
Right. And what I'm hearing from caregivers that we work with, that some of them that are used to being a 24-hour caregiver, they're saying this isn't that much different to them because they're isolated in their home 24/7. But for those that have support in the home, bringing in home care and getting out, taking care of themselves, they're really noticing a difference.
Mm-hmm.
And that the biggest challenge is for folks that have placed their loved ones recently, and not even recently, within the past several months, now they can't visit, and except for through the windows, or on FaceTime or iPads, and so that's really difficult for them, not being able to advocate. And they're advocating from a distance, but not having the personal touch as well with their loved one and worrying about them. So
right, and that's why I sort of mentioned it wouldn't be true of everybody, but some people have been exceptionally nice and willing to work with my staff to coordinate a little telehealth visit for the resident, so that way the families are a little bit more assured as well that somebody's watching over medications or other medical things that might be going on. And it's really, it's not a 40-minute appointment like I would normally do, but I think it just helps also to have another set of eyes. And
absolutely.
Yeah, and for the interaction with anybody for that particular resident.
Well, I'm thankful for FaceTime and Zoom and all this type of technology that helps us stay in touch, right?
Yes.
So you were talking about providing service to your patients. So tell me about the services you provide. Exactly what does that look like?
Currently, we are still accepting new patients that have to be done via telehealth. And so once I assess that, there are like medications that come into play. There's a little bit of counseling or psychotherapy or education that come into play. And this would be for in-person visits for, as well as telehealth visits. So I tried to do that for patients. And then if there is some kind of underlying cognitive disorder going on, I also try to help support the family. So that looks different for different cases. And really, it is kind of an individualized approach. Right now, being that there's a lot of people that cannot, well, everybody can't get to the office. So we're trying to, even if it's a brief phone call, we're trying to incorporate those into the schedule as well.
Oh, good. So you're accessible and you're taking new patients at this time.
Yeah, it's in fact, some people that had been a little bit further out on the wait list are finding that they're able to get in sooner because I really can't do an initial assessment for certain types of issues if people are not face to face, like live face to face. So those appointments have either been postponed or indefinitely
Yeah.
canceled. And so some people that are having the technology available and able to use it with support, they're able to get in sooner.
Okay, great. We want to make sure everybody feels supported and regardless what you're doing. And I think that's our purpose for presenting today and having you here we're all here to help you through this difficult time. Um, can you just give me some closing thoughts or anything you'd like to end on? Because I know you have some good ones.
Yeah, when families or patients are asking what they can do to help perhaps their isolation or feelings of depression or anxiety, I start with structuring the day. I really like to have a structure during the day. Otherwise, it can feel kind of like spinning wheels and you have all these things that you are considering or maybe not considering, and then nothing gets done, and that's kind of a defeated feeling. So what a structure in the day looks like, maybe a walk, maybe 2 walks, keeping keeping in mind that you don't want to overdo it either and then tank the next day. Um, I also like to incorporate a little bit of cognitive stimulation. And so there are a lot of free things right now, a lot of free musical performances. Um, there's Coursera, which has a lot of free courses for people to sign up for. There's great courses, a lot of these learning and self-help type of websites. UC, the University of California, has a mini medical school as well that is tailored to the general population on topics that are of interest. So those are all available. I always tell people that it helps when they reach out to others as well. So whether it be a phone call or a text or ideally like a Zoom session or a FaceTime session, it just is so helpful because it builds that collective sense of that we're in this together. We aren't, even though we're social distancing, we're not social isolating. And so that's how I kind of like to think about it, because this will pass. We would all hope that it would pass sooner rather than later, but I try to focus on the positives in that way.
Right.
And humor is always good.
Right.
I've come across a few humorous quotes as I'm reading through things. One of which people may know about. It's that this was a few weeks ago, and the quote went, in a few weeks, we're all going to be quarantined, and there's going to be a surge of babies in 9 months, and they're going to be called the coronies. So I thought that was good. And then since late night television comedy is back online again, or back airing, I can't remember who did this. I was watching Trevor Noah the other night from his living room. But the quote was, "Easter doesn't feel at all exciting this year, probably because I've spent the last 3 weeks driving around looking for eggs already. So things like that, they lighten the mood, and I think they're very helpful in these
Right.
times.
Oh, well, thank you so much for being with us today. And wrapping up from our homes, which is very different, isn't it, than being in your office. But
Yes.
wrapping up from our homes, we want to also let our clients know at Senior Care Solutions that it's a really good time to plan and get your documents in order. And if you anticipate having to look for a care setting in the near future or set up care in the home, make your connections now so you can understand how things work. Physicians might be more readily accessible right now to do paperwork for you because their practices are a little slower for the most part, I would guess, and your legal documents. So we're going to continue to have support for caregivers on here as we move forward with this series. And Dr. Chang also wrote a wonderful blog that's going to follow this article. So we welcome you tapping into that on our website, Facebook page. And again, Dr. Chang, we can't thank you enough for being here today, and have a beautiful day. Thank you.